All right. We try to be timely. So we're going to kick off. Again, thank you everybody for coming. We've had a lovely set of weeks getting ready for these domains. This is our second public meeting as we lean into the community level domains of food access, neighborhood safety, and access to green space. We have a pretty full agenda, so we'll get right into it. And again, I'm Sarah. If you're in the Gravity Public Terminology Call, you're in the right place, and we're looking forward to having a conversation today. Next slide. Welcome. We do mute folks on entry, but there's a lot of conversation throughout, so please do not even hesitate to add and reflect on the information that's happening throughout the conversation. All calls are recorded. The chat is utilized pretty extensively to react to to what's being said on the slides and to raise questions. We do try to integrate everything that's happening in the chat in real time and try to give space for people to unmute and lend their voice to the conversation. When there are formal presentations happening, we do encourage folks to hold their questions to the end, but generally we're more informal. Please send all chats to everybody just because that helps us keep everybody informed and aware. Next slide. And I also tend to read things out loud that are in chat as a facilitate, so there's a danger in not sending it to everybody. So if it's to me, I might just read it out loud. Gravity as a ANSI accredited standards development initiative. So we are part of HL7. So we follow the standards and guidelines for developing standards nationally. We have to comply fully with federal and state antitrust laws. It's just part of the requirement. So participants shall not discuss their pricing or others' pricing or any terms but affecting pricing or fees on the call. And we just apply these specifications pretty liberally. So it's not just direct avoidance of antitrust violations, but trying to avoid any behavior that might be construed as an antitrust violation. And again, this is just our requirement as being a standards certified developing entity. Next slide. We are going to have some brief announcements, brief coverage of fall 2025 topics and goals. Oh, I think neighborhood safety is actually first, so I missed. So just noting that the agenda is a little flipped here. So neighborhood safety is the first topic because we do have a guest speaker. And I'm grateful for that. Ruben, welcome. And then we'll go into food access, access to green space, and then continue on the agenda. We're going to do a deep dive into one particular instrument as well that we see throughout our domains this cycle, but this is the agenda as we have it right now. Again, with just the neighborhood safety and food access flipped. Next slide. Next slide. So just welcoming everybody to the Gravity technical work stream. Gravity has 3 different work streams. We are terminology, where we develop the language, healthcare language to tell critical stories. And then the technical work stream develops the methods and patterns of exchanging data across different settings. The technical work stream meets Wednesdays from 1 to 2. They just met yesterday. Really, we're deep diving and leaning into all resources and use case that came out of our social care voice co-design initiative that we hosted 1 year ago, year and a half ago, where we convened national experts across the social care ecosystem, from nonprofit entities to federal entities like WIC or community action agencies, block grant funded entities, to drive new use cases for Gravity work, and we're applying those within our member prioritized work right now. So those calls are fun. They happen again every other week, Wednesdays 1 to 2. The implementation work stream is quarterly. The next meeting is next week. And it happens the last Thursday. And our topics this year are on implementation with a lens on return on investment. We're going to be deep diving into how Gravity terminology and the technical implementation guide are being used as the framework and base of the New York waiver, 1115 waiver. So that's the focus of the meeting next week. So if you have any curiosity about how all the terms we create here in Gravity can get applied to real world use cases, that's a really fun meeting to go to. It should be very interesting. And then we are presenting, of course, at the working group meeting September 15th through 9th as part of our responsibility as being part of HL7. And then we have a couple presentations at Civitas as well. We look forward to seeing friends there. Next slide. Any questions on announcements? Again, everything I just mentioned should be available on the Confluence. Every meeting, if you go to the Confluence, one of the top navigations on the left bar is upcoming meeting information. So you can always find any of the 3 meetings for our work streams there. Next slide. Making sure I'm not missing. Sarah B is being amazing Sarah B per usual. Small world stuff happening in the chats. I love it. So what Gravity is, what are we? We are a representative sustainable consensus community that's collectively driving social care data standards to support the goals of population health and health equity. We are member driven in our governance. We are community supported in our work, and we are evidence-based, and we are glad you all are here. Next slide. We have lots of amazing members and we couldn't do what we do without them. As an HL7 accelerator, they're all member driven, which means members invest in the work and prioritize what's happening. We are unique in the HL7 accelerator world in that we're the only HL7 accelerator that has a designated membership based in our social justice framework. These are patient voices, community-based organizations, entities that wouldn't necessarily be able to do the paying member normative membership of HL7, but are critical for the work. We do have a process to accept applications for designated members. It happens once a year. So if you know any community-based organization or patient representing entity that you feel like would be a critical designated member voice, let us know at the end, the 4th quarter of this year, so we can consider it for the 2026 membership cycle. And again, these are really just direct care entities and patients, those critical nonprofits, food banks, action agencies that are out there doing the work, like community organizations, etc. Next slide. Our roadmap, we are in August. August is about to end. I don't know how that happened, Tasha. We're working on the community domains of food access, neighborhood safety, and access to green space. We always in Gravity work on enhancements. You'll hear later on in the fall, probably we'll bring back some of the program enhancements work we did last spring and last year. So you'll hear more on that coming. We are working right now on updates to our technical social determinants of health clinical care implementation guide that's happening in those technical workstream meetings, really cool use cases such as referral for further assessment or capacity, or even just developing the first standards for documenting enrollment in program. We have med lists, but we don't have program lists. And so that's all happening over in our technical call. And then our implementation affinity meeting, as we mentioned. Next slide. And then we're about to go into content, but we would be remiss to talk about content before we talk about our principles. Our principles are ever apparent, ever important, and there are 6 of them that guide both the development of our terminology and the implementation of our terminology. These include improving personal health outcomes, improving population health equity, ensuring personal control, designing appropriate solutions, ensuring accountability, and ever so critically, preventing, reducing, and remediating harm. Our principles and everything else I've mentioned so far can be found on the Gravity Project Confluence, but it's just important to ground ourselves in them before we do what we do. Hi, Lucy.
Hi, Sarah. I've just come from another meeting where consent to share data was a focus of conversation. And I'm wondering if eventually we could revisit this slide, these principles, and consider another bullet about, I'm not sure what ensuring personal control
That's
covers.
it, yeah. I was going to say in the description of, we talked about consent within that because we wanted to make sure it was ongoing and not just an instance.
Right.
I would love your perspective on the appropriateness of our principles and how they need to be updated. That sounds great. Yes.
So maybe we could have a session about that. I'm sure other people might have
Yeah.
other ideas. Thank
Especially,
you.
absolutely. 100%. That sounds great. So, um, yeah. Okay. Lucy's a friend and member and all kinds of wonderful things. All right, please review the principles. And again, we are community and we're iterative. So if you feel like we need to add and enhance things, part of our mission is we're not static. And you should see as we go through these meetings, you'll also see other things, that we have to enhance from previous work come up again. So that sounds great. And then maybe let's just figure out the right forum for that, like whether it's this meeting or the technical work stream or a special session, we'll figure it out. But yes, accountability to that, Lucy, that sounds like a plan. Um, all right, any other thoughts? All right. And then Lucy, one more thought on the consent thing. It's probably smart to integrate what the social care voice code design told us about these principles as well, right? So there were lots of data use considerations specifically from the nonprofit, non-clinical, non-HIT perspective regarding the sharing of data that came up, and that would be another reason to revisit them. Just saying. Okay. Next slide. I think we're into content, and I think I'm passing the first section. Oh, it's terminology, topics, and goals. My apologies. Next slide. Brief overview, and then I'm letting Asha and Ruben take over for a little bit. Next slide. This is a repeat of what we said last time. It's a busy slide. We're just saying it. So if you ever wonder why we're addressing community domains, this is the why. So the role of community health in facilitating sustainable health outcomes is long established. And it's supported by efforts in value-based care and population health. And we have been long talking over our 6 years that person-level interventions are simply not enough to get to the health outcomes we collectively seek, and one of them being health equity. I always try to call to mind the grounding conceptual framework that we use at Gravity, which is the World Health Organization conceptual framework for action on the social determinants of health, which clearly states that individual level, person level interventions are not sufficient, and we need to work on policy and structural drivers and community solutions if we seek the goal of health and health equity. We also know the community needs are part of the Affordable Care Act and federal regulatory guidelines through community health needs assessments for nonprofit hospital entities. And we've been planning for community level domains ever since our inception in 2019, like addressing household food insecurity, but carving out community food security, addressing individual level household concerns, but conceptualizing the need for neighborhood level housing considerations. And so we are here after a fair bit of planning. Next slide. We gave you all kinds of white literature. We're nerds, and I have to say we have our SMEs are just giving us so many beautiful papers. One thing about our Friends of Prevention Institute is white they're like white paper generators. There's just so many beautiful resources that are coming from PI, so thank you so much. So these are just some of the papers that you can read. We sent them out in the email. Next slide. I just want to make sure that we have time. And then I just wanted to say one little thing, a reminder. Um, in our work this fall, and you will see this in these slides, because of the community level of measurement, we are analyzing in our initial identification of need set, both instruments, like we always have, questionnaires, but also data that arrives from other sources, such as geographic data, census data, agricultural data, commerce data, satellite data, legal data, et cetera, et cetera. There's all kinds of data out there. We've long worked from data justice principles in our work. We've centered principles of data justice, and it's part of why we have our data principles. And we just note that we need to apply these principles, particularly here, right? So we have centered the work of Ruha Benjamin, Safiya Noble, Meredith Broussard, Joe Wilmini, and just many, many others in our understanding of the risks and harms of design of data. So we know that algorithms and data carry the bias of the designer, and so we need to thoughtfully think about any data source that we have at hand. And so just noting that very clearly once again, because if already we've been called in and thoughtfully asked to reflect on many of the available data sources. And we know, of course, how data can be used to tell stories of harm. So just kicking that off before we head into the domains of reference, that this has always been our guiding light, and it's just ever so more important now. You will see all kinds of new kinds of data, but we always carry this perspective with us. And then now, kind of leaning deeply into that, Asha's going to talk briefly, and then we're going to kick it off and have our one of our subject matter expert entities, the Prevention Institute, and specifically a friend from PI, speak. Asha, do you want to next slide? And next slide, you go ahead. Yeah.
All right. Well, good afternoon, everyone. Happy to be here again and do a very brief recap of neighborhood safety level set. So we're all on the same page. Again, neighborhood safety is a foundation for health and well-being, and that neighborhood safety is more than just the absence of crime. I want to really highlight that. It is a community level condition that influences how people live, move, rest, and thrive. And we originally called out and said that it is defined, it includes both objective safety and perceived safety. And Lucy, you alluded to this in our meeting last week, last time that we were here. Whose objective according to whom? And I want to call out that Rachel Davis from the Prevention Institute is one of our brilliant SMEs in the neighborhood safety domain. And she reminded us that these so-called objective measures, like Sarah just said, are constructed, right? And based on what gets tracked, who does the measuring, and whose realities are validated, essentially. So as we move forward, we're holding space for a more expansive, justice-centered lens on safety, one that includes both contextual and experiential evidence. And you're going to hear more about that from Ruben in just a minute. And then very quickly calling this one out, these are some key components of neighborhood safety. There's the built environment, which includes roads, sidewalks, parks, lighting, housing quality and infrastructure, neighborhood social environment. Some big concepts that come out of this are social cohesion and collective efficacy. And then moving on to neighborhood disorder. Those are things like visible signs of neighborhood disorder, like graffiti and vacant buildings and loitering and noise. And then finally, there are the economic and social disadvantage components of neighborhood safety. These are the structural components, and that areas with high poverty and low investment chronically face more safety challenges. And with that, I will turn it over to the man of the hour, Ruben Cantu, who is the director at the Prevention Institute, to share more about contextual and experiential evidence. And I will stop sharing so that Ruben, you can pick it up and share.
Thanks, Asha and Sarah and everybody else. And it sounds like a lot of the conversations you all have had have really kind of set this up very well. And I know that it's still a lot of what it sounds like from hearing you all talk and what Rachel has shared with me, very aligned with a lot of the stuff that we're doing. And this even aligns with the topics that were brought up earlier around personal control, as well, because one of the things that we touch on in this body of work that we've done around multiple forms of evidence talks about local ownership of data and who owns different kinds of data. So I'm going to pop a link. Some of you all have probably already see this. I'm going to pop a link into the chat for the page on our website where we have the report and some of the stuff that we've done around uplifting contextual and experiential evidence. And I'm going to share slides to go through a couple of slides on the topic. One of the things up front that I want to acknowledge is that this body of work that we did, which culminates in the report, it was work that was supported by CDC and specifically the Injury Center and the Division of Violence Prevention at CDC. And it was basically kind of led from here's a link, here's a snapshot of the actual report here. And what this actually came from is, CDC has a published framework on understanding evidence that includes talking about best available research evidence and also includes experiential and contextual evidence as the three kinds of evidence that we need to be using for decision making, for strategy, and all of that. And this project was an attempt from them and from us to really kind of hone in on how do we make it so that the concepts around not conceptual, experiential and contextual evidence are kind of held almost in the same regard as best available research evidence, and using data and statistics and the number, and how having a stronger focus on those, not to the exclusion of best available research evidence, but to really kind of work hand in hand with them and braided together, how those can help us get closer to our goals around health equity and racial justice when we're talking about community safety work. Um, I just realized I should probably rewind a little bit because I didn't even tell you who I was. I just jumped right in. I'm so excited about this work. My name is Ruben Gantu. Like Asha said, I'm a director at Prevention Institute, and I provide leadership around our safety and well-being portfolio. So that's kind of like a lot of the work that we do that's focused on community safety, violence prevention, community trauma and community resilience, and mental health and well-being. So kind of a body of work that works hand in hand with the other work that we do at Prevention Institute around building healthy, equitable communities, because they all kind of sit on the same foundation of looking at these community population level uh, factors and conditions that we need to address and that we need to improve so that we have the conditions for health, safety, and well-being in our communities, right? And we do that work in a lot of different ways, through technical assistance, through training, consultation, leading communities of practice, and learning communities. So a lot of the work that we do and a lot of the lessons we learn hand in hand with community members and community organizations, so that everything that we do is informed to one extent or another by community experience as well, which is why talking about the importance of contextual and experiential evidence is has just risen in importance to us. It's always been a part of the work that we've done, but it's just become so much more important to the work that we do, especially when we look at a lot of the challenges that folks are facing these days, especially. So I put a link in the chat to the actual report. And the report kind of goes over a couple of things around like the role of evidence in public health and decision making, a look at the landscape around evidence and how it's used, some components or some ways that we can uplift contextual and experiential evidence, how we can better weave together those multiple forms of evidence, and a set of recommendations. So I'm going to go through some of this stuff relatively quickly today. So like I mentioned before, CDC has a framework for thinking about evidence that kind of talks about these three forms of evidence. But we know in a lot of the work that we do, a lot of the work that is done in the public health sphere, there is a over reliance on best available research evidence. And we recognize through what we hear from communities that there is a huge importance in supplementing and balancing that with contextual and experiential evidence. And so when we're talking about, just to be clear, the way we're talking about contextual and experiential evidence basically boils down to, if I needed to boil it down to like 4 or 5 words, it's listening to and including the voices of people with lived experience in the work that you're doing. And contextual evidence is looking at the broader community context and community conditions and how that impacts how folks can see their environment, see what's going on, identify their needs and their strengths and assets so that we can work on decision making and strategies, right? And like just a very simple story that I can share that kind of like talks about the importance of making sure that we balance all of those things out. Our managing director, Sheila Savannah, talks about a project that she knew about that was going on in Houston, Texas, which is where she's based. And some researchers that she knows were working on a project looking at city data to identify neighborhoods with highest rates of violence and neighborhoods that needed to have a stronger focus on them, right? So, like, and one of the sources of data that they were really focusing on was the number of 911 calls in certain neighborhoods and certain communities. And using that data, they were able to identify a handful of neighborhoods. And when that, once the researchers and the people they were working with kind of like saw what neighborhoods were being brought up, a couple of people brought up and realized like, no, those neighborhoods are not neighborhoods that have a lot of violence, and they're actually very safe neighborhoods. And so instead of just looking at the data, then they did some door knocking, they did some interviews and conversations with residents in those neighborhoods, and one neighborhood specifically. And in having those conversations, they were able to they realized, yes, those neighborhoods had really high numbers of 911 calls. But the reason they had a high number of those calls was because the neighborhood had such an organized, like, community watch type of program where a community was very connected with each other. They talked to each other, they relied on each other. So whenever there was that incidence of violence and incidents of something going on in the community, everybody would pick up the phone and call 911. And so it wasn't necessary. It was, yeah, they had a high number of calls, but the number of incidences was really low. And they wouldn't have been able to really kind of hone in on that unless they made sure that they were balancing the data, the numbers, with the contextual evidence and the experiential evidence, and making sure that we are looking at all of those and kind of balancing them out. And so that quick story is a story that, like, really for me encapsulates why it's important to kind of look at all of those different forms of data. So we're basically the concept behind this work was to move from thinking about these as three different kinds of forms of evidence to making sure that we are braiding those three together to make sure that we are engaged in stronger decision making, more informed decision making about funding and strategies and policies and programs and long-term planning. And in doing this work, what we did is we looked at the available evidence and available research that folks have already done on using different forms of evidence, but we supplemented that with a lot of conversations with community leaders, community members in different parts of the country to talk about how they have been able to use these other forms of data to supplement the best available research evidence out there when they were making decisions, particularly decisions around community safety and violence prevention. And the things that came up as the key components to make sure that you're uplifting contextual and experiential evidence are around practicing meaningful community engagement and elevating lived experience, shifting power, ownership, and action to the community, implementing community-driven methods and approaches to evidence and data, and then making sure that we're investing for sustainability of use of that kind of data. So I'll go through those 4 components really quickly. So practicing meaningful community engagement, this is really all about making sure that as you're working on collecting these other forms of evidence, that you're being responsive to and tailoring to the needs and assets and strengths of communities most affected by the issues. Um, and I always make sure I've had to break myself out of always talking about doing a needs assessment in the community and broaden that out, because it's not just about the needs in the community, it's also about the strengths and assets in those communities and what they bring to the table. And we often don't think about that when we're talking about developing strategies for improving conditions in communities. And making sure that you have meaningful community engagement that's not only developed with the community in mind, but developed hand in hand with community. That'll really make sure that we're enhancing our understanding of the community context and the experiences of those folks that's not necessarily reflected in the literature. So, key strategies to help uplift this component are ensuring engagement is diverse, reflects the community, and involves a community of focus, and that you're also using it to build strong partnerships. A lot of times we hear of communities that are tired of being focus grouped to death. They're always being researched. Somebody's always coming in and doing a conversation or doing a focus group, and that's the one and only time they'll hear from these researchers. And we should really be thinking about this as a first step in developing those strong partnerships so the community members can be a part of identifying the needs and the strengths and the strategies, and they can continue to be part of the process as that kind of moves through the development process. Um, Shifting power, ownership, and action to the community. So, especially when we're talking about large institutions like healthcare, um, educational and research institutions, folks that have a lot of capacity, a lot of power, a lot of funding, and really, organizations that have privilege, making sure that you're able to work in a way through that community engagement and through engagement of community members in an ongoing process, you're able to shift some of that power to community members so that they can help shape the evidence and help shape the decision making that's going to impact them. So that can be things like supporting communities to collect, manage, and share the data, um, building their capacity to do that, to be the stewards and the owners of that data, through training and capacity building, through developing coalitions, and through assembling bodies to help mobilize and collect the community expertise and to be the holders of that expertise. Implementing community-driven methods and approaches. So that's all about making sure that our community data is describing community characteristics that go beyond those individual level data points to show kind of some of the overarching trends grounded in the community context. And as you're doing that, making sure you're taking into account specific historical contexts and trends and cultural assets within those communities. So making sure that we're, as all of us are aware, it's the importance of rigorous methodology and tools, but also making sure we're looking at it with that specific focus on the communities we're working in, and making sure that then we can bridge the numbers and the data that are coming in through best available research evidence to the narratives and the stories and the things that community members are sharing. And investing for sustainability. So making sure we have that commitment to long-term investment to sustain the collection, integration, the use, the stewardship of contextual and experiential evidence. We get into that conversation about like who's the owner of the data, and when thinking about that, and making sure that we're able to invest in this work long term to make sure that community can continue to hold that data and can be the stewards of that data. We did have a set of recommendations in the report as well. I'm not going to go into those in a whole lot of detail, but we developed, recommendations for different actors in the public health field. So for federal agencies, for local and state health institutions, for philanthropy, academic researchers, and community-based organizations. There's a lot of overlap in the recommendations here. But for health agencies, for funders, for folks like that, is like making sure that when you're having folks respond to requests for proposals or applications for funding, that you actually are weighing contextual and experiential evidence just as much as you're looking at best available research evidence and making those decisions on who to fund, for example, and making sure that that you have internal policies to make sure that projects are asked to engage with people with lived experience to inform the development, implementation, and evaluation of projects. So a lot of similarity across the recommendations for the different bodies within that we identified within public health, and you'll find this at greater length in the report. Um, and then just a snapshot again. This is a piece that Prevention Institute worked on along with our partners at Big Cities Health Coalition and RTI International in North Carolina around thinking about metrics for community safety and preventing violence. And a lot of these recommendations that we came up with here came from looking at best available research evidence, but also came from interviews with folks working in different capacities in different communities. So like health department staff, community-based organizations, folks like that, to kind of identify, what are the kinds of metrics that we don't usually think about when we're talking about community safety or violence prevention. And so this is kind of a sampling of some of those recommendations that kind of came up as part of those discussions, just to kind of give an example of like where we were able to apply some of the braiding of those multiple forms of evidence in the way that we've been doing our work. And I think that kind of takes me to the end. So there's my email address, and I'll copy it and put it in the chat as well for folks, as well as contact information for my colleague Vibhuti, who was the other primary author of this report and this body of work. So depending on how much time we have, and I'll let our folks at Gravity tell us, I can take a couple of questions. I haven't been taking a look at the chat either, so I don't know if anything's come up there.
I think we should give you time for, first of all, thank you. So lovely. And I put this, I think Rachel knows this. I put this in the chat, but I live in Vermont, so I was the beneficiary of Prevention Institute's Accountable Community for Health initiative that we
Yes,
practice
yeah.
to this day. So Lucy's like, is anyone practicing this? I'm like, oh, I'm like, we think about, yeah. So your wisdom is integrated into everything we do in my little state.
Great.
And but I do want to give time for questions. Any questions? Beautiful, necessary grounding and work, and just grateful. Any questions? Anyway, there's
Ruben,
no
could you go
questions.
back to slide 11?
Yes, Lucy,
Please.
that was a slide that was a partial response that I wrote you.
Okay.
Yeah. Oh, the one around investing in sustainability. Hold on, I can kind of pull it up again so we can see which one you're talking about.
If you don't know, I'm going to speak to, if you don't know Prevention Institute's work, if you just go to the website and see the projects that they are leading in the country every day, all the time, it is a thing of beauty. It is, yeah.
we're actually redoing our website also. So
Okay.
hopefully, I think by the end of the year, maybe we'll have a new website up that'll make things a lot easier to find. But yeah, is Lucy, you were talking about the sustainability piece.
Right, this slide and your experience of your recommendations resulting in commitment to long-term investment in the form of steady and flexible source of funding and investments in social capital and capacity building. Where is this happening and for how long does it go on?
I mean, and this is a tough one, and this is one that's even tougher right now, right? As we're seeing federal grants and federal funding related to data, um, like just disappearing. And we're seeing a lot of foundations having to step up to kind of try to fill that gap to make sure that we're continuing to fund that kind of work. It's just become a lot more challenging now. I will say, and I hate to be one of those people, but I toot California's torn a lot just because I'm based out of California and I've lived in California for 20 years. We have a very strong mix of philanthropic funders in California who work together and not just in isolation from each other. Folks like the California Endowment and Kaiser Permanente plays a big role in stuff like this. Blue Shield of California Foundation, the California Wellness Foundation, California Healthcare Foundation, like a lot of folks that put a lot of effort into making sure that any work integrates community voice and community experience. And then, to the extent that they're able to, and I think it's getting harder for the state to do this, but the state also puts a huge emphasis on that as well. Like, I don't know how many, I mean, I do know, but like, I personally have been a part of like a handful of like state and then local advisory committees kind of advising the state or local government on how to make sure that the programs and strategies they're implementing kind of reflect community
Mhm.
needs and strengths and assets. And when possible, like I go into those and I'm like, okay, I'm just telling you what I've heard from the community members and community organizations that we work with, but you really need to have those people on the ground doing that work, be part of these groups. Like, I can try to funnel and speak on behalf of them, but I also don't want to speak for them a lot of the time. So, and a lot of people they'll listen to that, but I think it all depends on where you are and the
Mhm.
kinds of investments folks are, one, able to make, and two, are willing to make. And those are
Mhm.
two very different things.
Mhm.
I'm really asking for your experiential evidence of, of how investing for sustainability has or
Yeah.
has not taken hold. And I certainly know about the California Endowment. And when they started, they were alone. So
Yeah.
your statement that other foundations have picked up on this at other states, and maybe this is an appendix in your report or should be an appendix in your report. Where has this happened? Thank you so much for this
Yeah.
work.
I mean, I think we wanted this to be part of an ongoing
Mm.
project with CDC. Unfortunately, the Division of Violence Prevention at CDC no longer exists as of this year. Um, there's like a diaspora of former Division of Violence Prevention folks that are scattered through other parts of CDC or that have been rift. But we continue to we've got some other sources of funding that we're kind of putting into this kind of work to kind of continue to expand
Mm.
it and um like be almost evangelical around like multiple forms of evidence and other projects that we work on that we pick up on, if there's an opportunity there to make sure that we're making the case for multiple forms of data and multiple forms of evidence, we incorporate that into all of our work. So we kind of spread that way as well. But yeah, I mean, my contact information and the link to the report are all in the chat. Please take a look. If any questions come up, feel free to reach out. Um, happy to talk to folks about it.
Love it. Thank
And
you.
myself, or like I said, my colleague Vibhuti, who did a lot of the on the ground research and writing on it.
Ruben, we're so grateful. Thank you. What an honor.
Yeah, thank you. Appreciate the opportunity to share the work a little bit more.
Yeah.
And hopefully it's helpful in what you all are endeavoring to do.
It already has.
And
Yeah.
I will I can share the report with or the slide deck with you all too, if you all want to share that out with
Yeah,
folks.
that sounds great.
Okay.
And hopefully this is
Please
just
do
the
that.
beginning.
Thank you.
Yeah, I would love this to be the beginning of knowing you as opposed to the it's been
Yeah.
really beneficial. Thank you.
Yeah, I mean, Rachel has been talking to me about, different folks on the PI team participating in different calls based on what you all are discussing.
Love it.
Because, we've got like the folks working on the neighborhood safety realm, but we also have folks that are working around land use and built environment a little bit more
Hmm.
explicitly. So there's other folks so it might not be the last time you see me, and or other folks on the team.
Lucky us. Thank you so much.
You're welcome.
All right. Okay, so that was so there's all I hope this is a demonstration of how our SMEs teach us in a million different ways, right? So there's the direct content that we work on, and then Ruben came because of the brilliant reflection of Rachel, one of our SMEs, in a subject matter expert meeting, and because of some of the comments in our public call. And we realized we wanted to fold in that conversation to ground our work. So grateful, grateful. I think we're ready to keep on going. We do have I think we're going to be okay on time. We are getting into I'm seeing the presenter view, not the slide view. Is that fair? Yes. Okay, good. Okay. I'm going to briefly talk about, I'm briefly going to go into one of the signature instruments that we see. Still grateful and processing everything Ruben said, but I'm going to move forward. You'll see over the courses of the next slide an instrument that's referenced across at least two of our domains so far, and maybe more. The AHRQ Medical Expenditure Panel Survey, or MEPS. We love a good MEPS. It comes up all the time. It's been in past domains. It's here now. And so we just wanted to ground everybody in what MEPS is before we went into the next two domains. Next slide. So the MEPS is an Agency of Healthcare Research and Quality survey. It's a survey of families and individuals, medical providers, employers, and it collects data on the specific health services that Americans use, how frequently they use them, the cost of the services, and how they're paid for. It came up extensively within our health insurance status domain and medical cost burden domain. This is one of the most trusted longitudinal surveys that we have, and it's an incredibly robust set of questions and answers on topics we address in our work. There is a supplemental survey that has been administered and is continuously referenced, and it's called the Social and Health Experiences Self-Administered Questionnaire, and it asks questions on social and behavioral factors. You will see this survey, questions from the Social and Health Experiences Self-Administered Questionnaire in our domains. There's also behind the Social and Health Experiences Self-Administered Questionnaire other instruments. So MEPS borrowed questions and methodologies from existing instruments across the ecosystem. So we're referencing MEPS, but also there's multiple instruments behind MEPS. But we just wanted to make sure that we grounded in MEPS and the why and the what of it before we went in and talked about our domains. It's as, sustainable and significant as like the American Community Survey and the census, right? Or the National Health, like the NAINS study for nutrition, right? So they're just surveys that are stable and solid and happen over time, and this is one of them. Next slide. We're going to go into food access now. Fun times. And we have maps. Asha and Sarah. We have maps. It's so exciting. So we're going to do the level setting one more time, and then it won't be here in 2 weeks. We're just going to level set one more time. So food access is really scoped out to describe the community experience of food availability and affordability. We did the household level experience in 2019. Grounded in the operational definition of the United States Department of Agriculture Food Security Module, which if you've been around Gravity, you know that very well. 18 items in the whole instrument, 10-item adult form, 6-item short form. A new instrument now that it is a short form for households with families, and it's the work that the Hunger Vital Sign was based off of. It's the gold standard for food insecurity measurement in the country. And as such, the gold standard, it then was borrowed internationally, like every foundational international approach to measuring food security at the household level is based off the USDA method. But there was a lot that was left, right? We didn't talk about community level access. We didn't talk about community level affordability, community level quality. And so it was left us to think about this in a future domain, and we're here now. Next slide. We have talked about access intersections, and before we talked about this last meeting, we talked about transportation insecurity, limiting access to food, and systemic racism affecting food security. So we're going to be leaning into intersecting topics. And we've already, I just want to note, our subject matter experts are calling us in again because we continually need to ground ourselves, and none of these things happen in isolation, right? We are like the social needs and social determinants of health are fundamentally intersected, right? And they influence each other. And so we lean into measuring and defining the specific, like face valid dimensions of community food access, knowing it's fundamentally intersecting with racism, transportation insecurity, income, wages, all kinds of other factors. But we're leaning into the food access element at this time. Next slide. Next slide. So we have a first standardized instrument. Our first, and again, pretty amazing work for subject matter experts who just met and are getting instruments to you right hot off the press. So this is from the Medical Expenditure Panel Survey, Social and Health Experiences Supplement, and there is a really robust question 3C in that instrument, which has all kinds of neighborhood characteristic assessments. It's kind of like Prepare question 14, right? Where it says, how would you rate the following characteristics of your neighborhood? And it rates a bunch of dimensions. Availability of places to buy healthy food is one of them. And you'll see it in other domains. Green space is another one. We're going to see that next. And it has the same answer concepts. Excellent, very good, good, fair, poor. The source instrument for this is actually an Urban Institute study that has a whole bunch of other fun things. We found that today, and we'll bring that back to you. But this is, again, a very solid question, leveraged in MEPS, long-standing and stable, and our SMEs felt it was a good initial understanding of food access. And because one of the things that we're trying to do across our domains is think about the highest level inclusive dimension of that domain at this time, like safety at the highest level, or what does access mean at the highest level, or what does green space mean at the highest level, knowing that there's other dimensions that we'll get into as we go deeper. Like, quality is one of them. Like we are talking about, we're going to have to talk about quality of, green space and quality of food as we go forward, but just does it exist is the first highest level. Next slide. And then there's another lovely instrument that we uncovered called the neighborhood scale. This is another approved instrument. And this is specifically leaning in not just to healthy food, but specifically into one of the most challenging things to access, which is fresh fruits and vegetables, right? So we know One of the critical concerns in areas with low food access is not being able to access fresh fruits and vegetables. We see this in both urban and rural environments. And so our subject matter experts felt like this was another good, solid question. So we have that highest level access to healthy food question. And then we have the specific fresh fruits and vegetables question. And again, this is from the neighborhood scale. And I think I'm missing a Y there. Availability of healthy foods, I should say. So happens when you make slides at 6 o'clock in the morning on half a cup of coffee. All right. And so again, these dimensions we heard, they're elevating general access to healthy foods, leaning in specifically to access to fresh fruits and vegetables. And then we have the MEPS survey, and then we have the neighborhood scale. Just trying to make sure I'm not missing anything, and I'm not so far. Okay. Love it. Okay. Next slide. Oh, and I want to just go back actually in dimensions. We talked about this before, but on the kickoff, I'm going to elevate it because one of the friends we have on the call, we are trying to make sure that we think about rural perspectives and urban perspectives because like food access is unique in both settings. We are trying to ensure we think about affordability because simply that it exists, if it has to be shipped to remote areas and there's no competition, the price of ranch, for example, dear friend, might be excessive, right? Because it can be, and because there's no reducing of the cost to the consumer. And then we also are by intention trying to weave in concepts of cultural appropriateness and food sovereignty in our work as well. Again, more on that to come. I talked about dimensions of quality, but we're going to be exploring how access to culturally appropriate foods is a critical element of this domain. This relates again to food insecurity. There is the Jennifer Coates Building It Back Better, lovely paper out of Tufts, which talked about cultural appropriateness and even household level food insecurity. So more to come on that. I just wanted to hold it up because a dear subject matter expert is on the call today, and I want to honor them and all their wisdom and more to come. All right, data sources, maps, exciting. I'm such a nerd. Next slide. As we mentioned, data sources are, we have to consider that the algorithm carries the bias of the designer. So we really tried to be as transparent as possible on the data sources, on the conceptual definition, and on the operational definition of these maps and these data sources so that there's full transparency. We have the technical requirements for all of these that we have access to, and we have the actual resource. So the first approved data source, again, we talked about this in community domains, our information's not going to just be arriving through instrument, right? We know this stuff through existing public data. Is the USDA Food Access Atlas. We just went to the most amazing webinar on Tuesday. The USDA expert on the Food Access Atlas and the Food Environment Atlas hosted a webinar on the updated Food Environment Atlas. Elena Rowan, we have the honor of working with her in this domain. Even though her bandwidth is very limited, we get to meet with her next week. Very, very exciting. We're so excited. So the data sources for the Food Access Atlas are the US Census, USDA SNAP authorized retailer information, and national market surveys that keep a pulse on supermarkets and stores across the country for market reasons. The conceptual definition is low access to healthy food defined as being far from a supermarket, supercenter, or large grocery store. That's very specific. There's other elements of food access in the Food Environment Atlas, but food access is the supermarket, supercenter, or large grocery store, which is really ensuring you have the core, everything you can get at a grocery store components. And so the way they get there is they find qualifying food stores. They do an incredibly lovely geographic analysis of the distance to nearest supermarket, which I put the whole thing there. They do 3 distance levels for clarity. Distance level, and it's urban to rural. So urban to rural 1 to 10, urban to rural 1/2 to 10 miles, and urban to rural 1 mile to 20 miles. Because understandably, you're not going to apply the same criteria for food access to an urban setting to a rural setting because of vehicles, transportation, public transportation, access, etc. And your low access if you have a significant number, at least 500 people, or a share of population at least 33% that meet criteria. So just for fun, we did a screenshot of my state of Vermont and Asha's home city of Atlanta, just in pictures, but we're actually going to go into the data for a second. It's only 5:02. We've got time. So Sarah B's going to start sharing, and Asha's going to take us on a data journey. Yay!
All right, a fun data journey. We wanted to make this a little interactive for you all. So
Doing great, Sarah B. So sorry. Thank you. I forgot to walk her through going to the component layers, but she remembered on it.
remember, yes.
And they have the link. This is Susan. They have the link in chat if they want to play along.
There it is. So as Sarah just zoomed in into my own neighborhood here in Atlanta, where I live and work as a community health nurse, y'all. And so you see all those dark brown areas there? They show census tracts where people are far from a full service grocery store. And as you can see, there's a lot of low access out there. Right. So I live in a place that, you know, in the literature, it's referred to as a food swamp. There's plenty of fast food, but almost nowhere to buy fresh, healthy produce. In fact, in my own life, I drive about 15 minutes to the grocery store to access good produce. And why that's significant is that about 40% of my neighbors are transportation insecure, which means they don't have that luxury of jumping in the car and driving down the road 15 minutes to pick up fresh fruits and vegetables. That might take them an hour or more to access that, right? And so this is not just about convenience, y'all. It's about health and it's about survival. And one thing I want to also say is that the low access to healthy food is also directly tied to higher rates of diabetes, high blood pressure, and obesity, all of which increase the risk of poor birth outcomes. And I am an impassioned maternal health equity advocate, so that really matters to me. In fact, here in Georgia, March of Dimes gave our state an F in terms of preterm birth in our state. Black women are about 15% of Black women birth preterm, and that's regardless of income or education level. So when we talk about food access, what we're talking about is maternal and infant health. We're talking about life expectancy, and we're talking about justice. And this map really does make it plain. There is no health equity without food equity. And no one should have to travel far to just feed their family well. So, Sarah, thank you so much for taking us on this journey to explore this first map, this first data source for food access.
Masha, thank you for telling the story of the data. We love you. When you look at, it's interesting because one of the things that happens in our own team is looking at the difference between rural variables and urban variables. So you can see even in Vermont, like I'm the topmost where I practice medicine, that topmost brown element and all of the brown elements in the corner are all the people I take care of on a daily basis. That's where I work. Yes. All right, so now we're going back, and I think we're back in presentation view. We want to get back to the Asha. Now I understand why you didn't want to flip. I get it.
Yeah.
I get it. Sweet. All right, so now we're going to access to green space. I think I'm going to go through the slides and we're going to do the same thing. We're going to do a map story. Next slide. So even though I think, well, we're up there. So access to green space, level set. So public green spaces, including parks, gardens, trails, and natural areas open for public use and well-being. Access matters, including so that the first level that we're talking about is kind of the highest level. Does it exist? You'll see in our initial data, we're literally just getting to the highest level. Like, is there something near you, right? Into the next bullet is access matters. It includes physical access, which is both proximity. You'll see some of that in the variables we have today, especially in the map data, proximity, and walkability. Walkability is also in there in one of our, I think it's ParkServe that has the 10-minute walk statistic. Social access and ecological quality and biodiversity. This last facet kind of relates to that quality element we were talking about with food as well. So that it exists is great, but is it of high quality? And another thing that we are exploring as we go into our access to green space is the difference between curated built environment spaces and wild spaces. So we're thinking about rural and urban perspectives. We're thinking about pure access and elements of quality and ecological diversity and biodiversity. Oh, we're going to add a friend who is going to help us keep the environment and climate in mind whenever we're doing our access to green space work as well. So that's all to come. So key concepts within access to green space are health promoting infrastructure, built in natural environments, and always ensuring that we keep the health equity lens in mind. Again, we discussed this in our systemic racism work in the spring, right? So access is not evenly distributed by income, race, age, ability, and location. They all shape different opportunities to access to green space. So now, next slide. We're going to go through instruments. You're going to see some friends here. Next slide. Our good old friend MEPS, right? So if you look at question 3B, how would you rate the following characteristics of your neighborhood? Availability of parks and playgrounds. The answer concepts are excellent, very good, fair, and poor. And again, it's the highest level. It exists, it's available. And then we'll get into quality and different features going on. But this is the first element of access to green space that our subject matter experts approved. Next slide. And now more maps. Next slide. There are two different publicly available curated data sources that involve beautiful maps that we will detail today. So as I'm just going to ground us again, so because of their community level domains, sometimes we get information through questionnaires, and sometimes we're going to have information through other data sources. The first is a resource of the Trust for Public Land. It's called ParkServe. It analyzes urban cities and towns. That's a variable that I wanted to just clarify because it really leans into urban cities and towns. The conceptual definition for access is defined as being within a 10-minute walk to a qualifying park. So here, that being two of the elements that we had in that previous slide. So it exists and you can walk to it, right? So the operational definition, the population is based on the 2024 US Census Block Group estimates. To be included in a park of reference, it has to be located outdoors, be a named destination, e.g. not an unnamed median or drainage way. The reason why our team found this interesting, and when we think about our subject matter experts, is a lot of the places that are significant to us are wilder spaces that are not named. So this is just something we discovered as we're thinking about this, this map. The park needs to encourage informal public use. And it needs to encourage I love this park-like activity, such as socializing, enjoying nature, or playing and exercise. And the way they got to the 10-minute walk analysis is they calculated 10-minute walk service area for each park. And this is all geographer stuff by creating half-mile walkable service areas. They use the S3 Street Map Premium Network data set, right? So all publicly curated geographic information. The technical information is all available in the TPL.org Park Data Download Brief if you want to go nerdy and look at all the dimensions. Next slide. So here you can see we're going to do the same kind of journey. Oh, hi, Lucy. Yes.
Yeah, Sarah, could you go back to the previous slide?
Yes.
Thank you. I just want to emphasize that being within a 10-minute walk refers to people who walk.
Oh, there's a whole other, yes, there's a whole variable that describes that.
That's coming. Thank
Yeah.
you.
Yes.
Okay, cool.
Yeah. Yeah, that's partly why I talked about accessibility is, there are limitations to each different dimension. I mean, to each different data source. Yes. Hear you. Thank you for always caring about things and everything. So we just wanted to give a still to show you what the variables look like here. So this is the still from the Trust for Public Land Park Serve page. This is the city of Atlanta again. So you see the variables. So the parks with public access is the base variable. The 10-minute walk service area is everything in the light green, right? The park with public access is the dark green. The dark green's the park, the light green's the service area. The population within a 10-minute walk is detailed at the top of the brief. You can see 82% of the people in the city of Atlanta are described as having like access to green space as defined by 10-minute walk service area to qualifying park. And then they also go through and based on the GIS analysis, tell you areas that are needing parks, moderate need, high need, or very high need, depending on proximity. I think we're now going to another map and another Asha story. Is that true? Yeah? Or no? No, not this time. Asha's like, I'm getting lost. It's been a very long day. You're very kind. It has. It's when you realize you're at the end of your day and you're like, okay. So that was the application of the Park Serve. So the next public data source is the National Environmental Public Health Health Tracking Network. This is a CDC reference. I do want to honor the CDC again in the the driving like need of this work. It makes me think of our dear friends at the CDC who helped plan our built environment work about a year and a half ago. And so this is just a CDC curated website, and this analyzes US Census tracts. So it's not just limited to urban environments. The conceptual definition is either the percent or the number of people living within a half or 1 mile of a park. The operational definition is people living within a half or 1 mile radius of a publicly accessible park determined at the census tract level using the area proportion technique, fun geographic techniques. The population data comes from the American Community Survey 5-year census tract estimates, and the park data sources are via these incredibly nerdy geography resources. There's also indicator details that you can go down. So this is again one of those instances like when we did food insecurity, we were very careful to align ourselves with the existing methodology if it was a trusted methodology as it was with the USDA food security module. So this is how the federal government, both at the USDA with Food Atlas and the CDC and with the National Environmental Public Health Tracking Network, determines these variables. And the reason why that matters is much of the research, Ruben noting the complicated nature of research and contextual evidence, is based on these variables because they're publicly available, right? So when we think of the health outcomes of lack of access to green space, that research is often based on this because it exists and it's steady and it's been around a while. Next slide. So I pulled out state of Georgia, state of Vermont again, just because it's fun. And so these are two different slides that detail access to parks within half or a mile of a park. And you can see the legend there at the bottom. The interesting thing is you start to see how rurality comes into this map when it did not come in before, right? So that blue corridor, so rurality is a feature in US Census tracts. It's not a feature when you're only limiting to urban areas, right? I mean, it's not as much of a feature, I should say. So in Vermont, that blue, dark blue is Green Mountain National Park, right? So every single person living in those mountains, 83 to 100% of them lives in a walkable distance to a park because they live in a park, right? And so it's helpful for me as a rural person to see how that rural data transposes. Same thing as the top right corner of Vermont, right? So there's, you start to get into the presidential range across the street in New Hampshire, more national park land and state park land. So in rural areas, the park bit is not necessarily just the city park or the urban park, it's also any named national park that's fit for purpose. So now we have 2 data sources and access to green space that we are referencing in this work, and we have one high level instrument, I think. Next slide. I think this is the end of our domain work. I'm just going to take a pause for a second. So we've been on a journey today. We've been talking, we had a grounding in, in the beginning, in the way beginning on considerations in data and trying to understand that all data carries the biases and, intent of the designer. And then we went into our neighborhood safety domain, and Ruben and Asha presented high-level concepts, and then Ruben took us on this beautiful exploration of Prevention Institute's working with the CDC on contextual and experiential evidence and how it weaves into research evidence to provide, like a sustainable and equitable path forward. And then we went into our 3 domains, which now have both questionnaire level information and publicly available data sources that are going to feed into the kinds of assessments that we're making on the people that we're trying to take care of and the communities we're taking care of. This is our final section. I think we're actually on time, which is amazing, Asha. Next slide. This is a lovely slide to close on, especially since it makes me think about what Ruben was saying. I don't think is he still here? Did he leave? If you're still here, Ruben, you mentioned how the topic of community health needs assessments is problematic because a needs assessment doesn't talk about an asset assessment. And we just wanted to bring back in the work of the Ripple Foundation and Vital Conditions that we referenced in our protective factors and strengths-based work. Yeah, I think he left too. And we just wanted to hold up the fact that there's themes throughout all of our domains. The role of community culture and ecology, the role of social connection and social cohesion. And then we think about these terms that we developed in our work, really guided by our colleagues at the National Indian Health Board and Jessica Sandwick-Ulrich, who pulled up the Indigenous Connectedness framework. We also think about the community connectedness, nature connectedness, and civic engagement elements that we're building out of our strength-based work as well. Because all throughout this conversation, we're talking about the structural forces and interventions that really are the goal that mitigate maybe this minuscule neighborhood safety variable. And they certainly lie in these kinds of interventions. Next slide. I think we're going to close with homework. So if you have instruments, next slide, that you feel like are of assistance for our 3 domains, please send them along. If you have data sources that you feel like are helpful, we have been finding a trove of different data sources, satellite imagery, tree equity scores. I mean, there's just a lot of beautiful stuff out there. Send us anything you can, and then we will be back in 2 weeks to pick up the torch and keep on going. Lucy?
Yeah, I'm sure everyone is tired of hearing from me, but I just want to throw out to this incredible group that I'm going to say early this century or late last century, there was an extraordinary lawyer in Los Angeles who mapped access to green space to document how lack of access correlated very strongly with ethnicity.
Mm-hmm.
I cannot
yeah.
remember his name, and for sure I can't retrieve his work. If anybody on this call remembers that or loves to dig and maybe find it, I want for us to acknowledge him, because when he first did that, it was unprecedented to my knowledge, and it was sensational because no one had ever thought about access to green space as health related. So I'm just throwing that out there. 30 years ago, 40 years ago.
My guess
Anyway.
is that Rachel and the team at Prevention Institute because Rachel's Oakland based, right?
Ryan too.
and Ryan's to a policy link. Lucy, I bet you if you can write, first of all, Lucy, I want to credit you for being the source for actually many of the SMEs on the call because you sent us a couple papers and it started this journey of subject matter expert gleaning. So thank you, Lucy, for being you.
Thank you.
I
Yeah.
just read Mark's comment. This is
Oh,
Susan. I have a question for you, Sarah. You showed us a lot of maps, and behind the maps are many attributes and information that they use
yeah.
to create the map. Is
That's
there any of that information that we are going to want to have available to put on records?
Oh yeah. So that's partly
So
why
we're going to
I
encode
pulled all
some
the,
of the,
yes, partly
okay.
why I pulled in all the Susan Matney, my little friend, my not little, but just my dreamy friend. That's why I went through all the technical specifications.
I'm like,
I
I want to see the
I
attributes
can
behind those
attest to you that
maps.
I have gone down and to drill
Okay,
down to every minute
okay.
variable that's being measured in driving and the data. The only thing I couldn't access are the proprietary geographic map stuff like TomTom. I don't have access to TomTom, right? But yes, I have the technical specifications for all of the instruments we've referenced, and they are very, very fun. And I would love to share them. And the thing is, they already exist, right? Many of them already exist. So it's like, yeah, very exciting. Sorry. Yes, Susan, let's play. Janice?
Hi, I've been watching mostly. I haven't participated much. I just want to say, I had looked at the green space map in my area. I live next to a university, so almost every day I walk through it. I'll walk a mile and it's, there's a lot of, it's a beautiful in the middle of Seattle. CLU has gorgeous trees, I feel like there's canopies of it. But where I lived previously in Seattle was a very expensive area. All the homes, $1 to $3 million, way more than one now. But anyway, and there was a park in the middle, and these are old homes, some of the original Seattle homestead kind of homes, and not homestead, but actually mansions from the wood barons and whatever. But right on the other side is where actually we were sandwiched between two freeways. So it was really interesting. So, really, could be it. I don't know how it was marked. I haven't really looked it up because the air quality, behind me, the freeway was really bad, right?
Mhm.
If you lived on the other side of the park, it might not have been bad. So you have to really kind of look at the bigger picture. And so zip codes isn't close enough, right? I appreciate what Asha shared, getting down to some of the specific neighborhoods is very helpful. Thank you.
Yes. And so Janice is partly because I misremembered, but like because what happens, we review all this data as a team before we bring it. And like the quality of the park you live in is it like the map of Atlanta that shows all those gorgeous parks and that every single 82% of the people have access to a park. It looks like it's like La La Land, right? Valhalla. And then what I know from talking to my dear friend is the park right across the street from her is not great.
Low quality, but we have
Yeah.
access.
Yeah, you have so we'll try to think about those elements too. And then it looks like Corey found the name of Robert Garcia. Maybe a little chat GTP help just because I know you. And then Ryan elevated it. Ryan also sees like put in. I think this is actually one of the papers that Ryan sent. Lucy is the paper that you sent to us, right? So this is like the thread. Just want to note that Ryan, that's how we found you was Lucy. I love it. Okay. Amazing. Thank you, Corey. Thank you, Ryan. Thank you, Lucy. And I think we're close. Any other final thoughts? It's nice to have a little bit of time just to reflect together. You're all so lovely. Thank you so much.
Sarah, this is going to sound crazy, but one of the positive things going on locally is police department wanting to relate better to the community, quote unquote.
Yeah.
And let's not get into the ironies or paradoxes here, but just to take this at face value, police and parks are now, to me, a dimension to think about. And the invasion of the park in LA last week or 2 weeks ago, police invading that park, it was just, so parks are both obviously so incredibly positive for health. I just want to throw out, let's think about all the entities that we do not associate with parks and whether they're relating to parks. So at least the police department that I know of is doing that. Thank you.
Fascinating, Lucy. And that relates to some of the elements Ruben put on the slide regarding community safety from his work with RTI. So we're exploring actually police trust in law enforcement as a variable, and we've uncovered some pretty lovely surveys to try to get towards concepts in community engaged policing and law enforcement trust. We had a lovely initial conversation, but more on that to come, I think, because the community safety is hard to address without thinking about that element. Lovely. I think we did it.
I think so.
Thank you so much, friends. Any other final thoughts before we go? Otherwise, have a lovely Thursday. And we'll see you again in 2 weeks with new instruments, new data sources, and maybe some new maps. Love me some maps. Bye.
Thanks, Sarah and Asha and everybody.
Thanks, everyone.